Barcelona defender Gerard Pique is expected to miss a number of months after injuring his right knee on this tackle this past weekend. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. Today, we're going to be breaking down what happened here with Gerard Pique, talking about his specific injury mechanism, what exactly was injured in him, and then talk a little bit about the basics and how they manage these types of injuries. As always, if you enjoy learning about this unique side of sports, then please consider subscribing to my channel, and be sure and go follow me over on Twitter for more real-time breakdowns and analysis. So in this first view, we can see the Atletico Madrid player come in and basically make contact on the lateral aspect here of Pique's knee. We'll switch to a different angle here in a second. You can tell though right away from this view how Pique's knee collapses inward into this valgus position. Valgus is when the knee is inward and varus is when the knee is outward. So clearly here we can see the femur coming down and then the tibia, the lower leg, out to the side with this valgus positioning. The other player here is directing a valgus force onto the outside of Pique's knee, which is the common mechanism that we see for what Pique has, an MCL injury. We can see another view of it here. Again, Pique's right foot plants here, and then the other player basically just falls into that outside of his knee. And you can see the severity in terms of how much that knee collapses inward here due to the player making contact and just forcing it in. Now, what'll be important for what Pique actually suffered is whether or not there was any rotation of his tibia relative to his femur. The femur is going to be this upper leg and the tibia is going to be down below. And that's really where we start to see more of an ACL tear pattern come in, is when there's specifically internal rotation of the tibia relative to the femur. It's almost impossible to tell here just in this footage review how much internal rotation there is. Certainly kind of as he follows through, that knee kind of comes inward a little bit, and that could be really the final part that did put some injury on that ACL. Now, the official report from FC Barcelona is that Pique has a grade 3 sprain in the internal lateral ligament and a partial injury to the anterior cruciate ligament in his right knee. Evolution of the injury will condition his availability. What they're describing here, this internal lateral ligament, that's the MCL. And then of course the anterior cruciate ligament, that's the ACL. So this report is telling us that he has a complete or grade 3 tear of the MCL and a partial sprain or a partial injury to his ACL. Looking back at these structures on our anatomy model here, this is a right knee. So this side is going to be the inside of the knee. This is the outside of the knee. Of course, our femur, our tibia, and then our fibula on the outside. If we turn to the inside, this is going to be the MCL. Now, it's interesting they called it the internal lateral ligament, which makes sense. You know, it's the internal aspect of the knee, but I think just a difference in terminology between here in the States and over in Europe. Of course, then the LCL is going to fall on the outside of the knee, and deep inside, we're going to have that ACL, and then flipping around on the back, our PCL, and of course our two menisci in the middle. Remember, the MCL here is like a rope, basically giving passive stability to prevent that valgus or inward movement of the knee due to where it's running between the femur and the tibia. If I've got a force like a player coming in from this outside, that's gonna push the knee, that's gonna make that inside part of the knee wanna spread apart, but that MCL is gonna be there to try to keep it in place and make it stable. So if we go back now to the play where this happened, in this position, there's really not any excessive stress on the MCL. It's being stretched a little bit just to provide that dynamic stability. But then here, as soon as the other player comes in and imparts that lateral load, moving the knee valgus, that movement right here is when that MCL gets put under max tension and when it completely tore. Now, in regards to the ACL, if we look here, you can see how there is sort of an angle that the ACL takes within the knee. It runs from kind of the anterior medial aspect of the tibia across the knee to the lateral aspect of the femur. So it kind of runs at a little bit of an angle here. What that means is that if you take the tibia and you internally rotate it relative to the femur, you're going to stretch it even more across that diagonal plane. So that's why when we see ACL injuries, we're oftentimes looking more for that internal tibial rotation that is going to put more stress on the ACL. Again, going back to the play here, it's tough. Certainly at the end, this kind of last little bit, it looks like there is some internal rotation of the tibia, but with these contact injuries, it's always a little bit more difficult to say. But this position is classic for an MCL tear. The knee is partially flexed, meaning partially bent. The tibia is, even in this position, a little bit externally rotated, which is going to load the MCL more. You can tell that because his body's kind of facing more forward, and it looks like his right foot is pointed a bit to the outside. So perfect setup, most common thing that we're going to see for an MCL injury. A couple other interesting little tidbits here. You can see that the MCL is a much longer ligament than the LCL. Also, you can see that the deep portion of the MCL fibers are actually connected to the meniscus and play an important role in the function of that medial or inner meniscus. Most of the time when the MCL is torn, the injury occurs closer up here by the femur attachment site. Tears in this proximal area are also better for healing compared to tears that occur down here distal, lower on the tibial insertion. So again, in the case of Pique, we're being told that he's got a complete, meaning this MCL is completely torn, but then just partial injury or stretching of that ACL. The partial wording here is tough to know exactly what they mean. This could be a grade 1, it could be a grade 2. It just tells us it's not completely ruptured. But still, it's important to know that a stretched ACL is not an effective ACL. This is a very intricately tuned system, and so even though that ACL is not torn, if I take it and I stretch it to make it 25–30% longer, it's now loose. The knee is gonna have some inherent laxity that's gonna make it feel unstable and make it more likely to actually tear whenever a player gets back if it still is healed in that elongated stretched position. So Barcelona has a decision to make here in terms of management. Now, typically a grade 1 or a grade 2 MCL injury oftentimes are not gonna require surgery, but grade 3 is when we start thinking about, yes, surgery. Now, I'm not a surgeon, but I do know there are times when if the knee is overall pretty stable, even with a full MCL tear, they might not elect to do surgery. It depends on so many other specific details based on other injury patterns and exactly how bad, how displaced the two ends are. There's a lot more factors that go into making this a question of yes, 100% needing surgery versus no. It really depends on each individual's very specific pattern, but in general, most of the time grade 3, you're gonna be thinking surgery. But being that it's grade 3, even if they don't require surgery for him, it's gonna take a long time to heal. I've seen reports that they expect 4 to 6 months. This could be a little bit on the long side for the MCL and could be thinking more with the ACL injury, but I certainly expect this to be a multiple month absence for the Barcelona defender. That's it for the video though, everybody. Thank you as always for watching. I hope you enjoyed it and learned something here about the injury mechanism and the anatomy here of these structures. Let me know any questions or comments down below, and until next time, we'll see you later. Bye.